Good morning, everybody. This is Dr. Tyler Evans from Arete Chiropractic, coming at you live this morning with the research moment. And today what we were talking about is this brand new paper that just came out, I think a few months ago. It was 2019. It was by Robert Kessinger and the knee, chest, upper cervical group. This was actually a multi-office oriented study, which is really cool because they were able to reproduce the results across many different doctors and many different offices. It was Robert Kessinger, Trevor Qualls, John Hart, Henry Dallas, Michael Anderson, Jared Whalen, and Leland Bradshaw, all upper cervical chiropractors. And what we're talking about today is this topic and thing called pulse pressure. So what is pulse pressure? We'll get into that in a second, but the title of the paper is Pulse Pressure Findings Following Upper Cervical Care, a Practice-Based Observational Study. So what is pulse pressure? Pulse pressure is an indicator of cardiovascular health and is the difference between systolic and diastolic blood pressure. An important etiological consideration is the autonomic nervous system balance. What is the autonomic nervous system? We'll get into that in a second. The purpose of the study is to observe pulse pressure changes following upper cervical corrections and a 6-week course of care. So working on the upper neck and measuring what's happening to the heart blood pressure, the pulse pressure, the diastolic and systolic change. Now, what we know is that there were 130 patients presenting in 5 different clinics, were separated into 3 groups based on initial pulse pressure groups with 40 millimeters of mercury considered as normal, which is 120 over 80 is considered normal. So that's that 40 millimeter of mercury difference. The medium was 49 millimeters of mercury, and high was greater than 49 millimeters of mercury. So larger than a 50 millimeter mercury difference. So it would be like, for instance, 80 or 130 or higher over 80. So that would be a high difference in pulse pressure. Now, what they did was they did 6 weeks of care. Pulse pressure reduced by 8.9, almost 9 millimeters of mercury in the high group, which was statistically significant with a large effect size of 0.8. Changes in the low and the normal, or the low and the medium groups, or normal, were not statistically significant, probably because there wasn't a real nervous system issue with the brain-body connection for those people. I'm just saying that. The paper doesn't say that, but that's what I'm saying. And the conclusion is, in this observational study, the group displaying the highest pulse pressure demonstrated statistically significant reduction in pulse pressure. So what does this mean? Well, elevated pulse pressure is a recognized cardiovascular risk factor, and some studies have suggested to be a marker for preclinical cardiovascular disease. A meta-analysis involving 8,000 patients found that a modest increase of 10 millimeters of mercury in pulse pressure increased the risk of cardiovascular events and mortality by almost 20%. So those people in this study, out of the 100, I think it was like 30 people, the percent that were in the high range, in that high pulse pressure range, so that big difference between their diastolic or systolic and diastolic, the lub-dub, that group would have been in this range that was in risk of cardiovascular disease events and mortality by almost 20% more than the other groups. And now that's lowered because their nervous system is balanced. So let me explain why. So in an upper cervical office, what we do is we measure the differences between the head and the neck and how that's affecting the entire body and the entire nervous system. Because that upper neck is the most prone to accident and injuries because it's the most mobile, but it doesn't have a bony lock. All that holds it together, ligaments, tendons, and muscles. And your brainstem sits right up there. And what does your brainstem do? Well, your brainstem is what controls your autonomic nervous system. So right here in this picture, we have the parasympathetic right there. and the sympathetic nervous system. The rest and digest and the fight or flight. Now, if we look here, heart controlled, right? Heart controlled by, if my little screen will focus, the vagus nerve here in the parasympathetics. So what is the vagus nerve? Well, the vagus nerve is it's called the wandering nerve, but it controls all of the internal organs in their parasympathetic control. So the slowing down. And we have a direct connection between the brainstem right up here, right where the upper neck sits, and that vagus nerve control of how the heart regulates itself. So we know that there is a direct nerve connection between the brain and the heart. We know that people that have high risk for cardiovascular disease, they may have this imbalance in the neck. We see it in this paper, and we've seen it many times. There are many papers that I've gone over here. The Dickholz study. There are many other studies that we've talked about with heart rate variability. All the other topics where the heart can be affected by how the neck is aligned, and we see it in our office where the blood pressure will decrease after 6 to 8 months of care. So it's an observational effect. If you know of someone that's suffering from high risk of cardiovascular disease, obviously diet and exercise are a big part of that. However, there are many stories where we've heard of this super healthy person has a heart attack and passes away, and it's weird because there's no reason why that seems apparent. And sometimes it might be just because the nervous system is not connected, the brain to body connection is not there. And that's what we do in an upper cervical chiropractic office, is we work to connect that brain to body back up, so all the messages are flowing back and forth from the brain down to every organ, tissue, and cell, and from every organ, tissue, and cell back up to the brain. And so Dr. Kessinger did a great job in this paper. Fantastic study. And you know, we are thankful for all those that do the research out there in the upper cervical world. And if you guys have more questions, give us a call. Our office is Arete Chiropractic in Portsmouth, New Hampshire, 603-380-9184. That's 603-380-9184. And I hope you have a great day. Have a good one. Talk to you later. Bye-bye.